Hey everybody, it's your favorite doctor, Dr. Tiffany Butler. And so hopefully you watched my previous videos. We talked about pregnancy, how we can help mommy. Already we talked about the baby. And now we're going to talk about small children and we're going to get into the adolescents. Okay, so we go over the anatomy again, right? So the different regions of the spine. We have the cervical spine or the neck. We have the thoracic spine or the mid-back. This is where your ribs connect here. We have the lumbar spine or the lower back. And we also have this here part of the spine. This is called the sacrum and this is called the coccyx. Okay, all right, so let's now be oriented. Now, can your child age 3 and over, right, see a chiropractor if they're having back pain? And with children with experiencing back pain, right, we want to rule out certain things. And one of the big things we want to rule out, of course, is meningitis, right? So if a child has back pain and also accompanied with the temperature, right, then that's not in our ballpark. Chiropractors, we're not going to mess with that. All right, now, if your child has back pain, no temperature, they've been cleared, and it's ruled out, hey, they don't have meningitis or anything like that, it's a musculoskeletal thing, meaning maybe your child has poor posture, right? Maybe your child was lifting something and hurt themselves, or maybe they were in an awkward position, you know, if you have a very active kid, right? So I've treated small children. I've treated small children who've been in car accidents. I've treated small children who have fallen and hurt themselves. And the same thing we do in adults, we go through a physical examination. Now, it's very different. I always tell people the exam that you receive from a chiropractor is very different from the exam that you would get from the MD. Our scope of practice is different. How we look at the body and how we treat the body, you know, is very different, okay? So we're assessing how well your body is positioned, how well you are able to handle gravity in a static position. What do you look like when you're standing and when you're sitting still? And what do you look like when you're moving? All right, so the children, I may do a little bit more. You know, sometimes children have a hard time articulating the type of pain that they're experiencing. So one of the things I really do is do palpation, right? Palpating the area, looking for any tight muscles or any areas of restriction, as well as having them go through range of motion and also body movements, okay? Now, this gives me an idea of how well they're moving. They don't know what I'm looking for, right? And they may or may not compensate, but it gives me an idea of where to treat them or how to treat them. Now, there are some therapeutic procedures that children can use, and there's some things that we cannot use on children. One of those things is therapeutic ultrasound. However, I've used other types of therapeutic modalities on children. I'm a big fan of exercising. I do kinesiotaping. I do soft tissue work. Anything that's going to help that child get better with very low side effects, all right? So if your child is experiencing neck and or back pain, and they don't have a fever or anything like that, and they've been cleared, or you just want to see, hey, can the chiropractor help me with my child's posture, then I always recommend scheduling an appointment. All right, if you have any questions in particular about chiropractors and children, pregnancy, and infancy, send me an email at info@drtiffanybutler.com. Thank you always for watching, and as I always say, that healthy mind and healthy body creates a healthy life. Till next time, stay healthy.